And the CDC today warning the efficacy of COVID-19 vaccines for children fell sharply during the age of Omicron. News 12 Connecticut's Sean McCabe has more on what local infectious disease experts are now saying.
While we're thankful that most of the time COVID is relatively mild in kids, they get over it, they do great. But there are those occurrences where some of them are sick enough to be hospitalized.
A preprint study from the State University of New York says by 7 weeks after their Pfizer vaccination, protection for 5 to 11-year-olds against hospitalization plunges from 100% to just under 50.
Even being fully vaccinated does not protect us as well as we would hope against Omicron.
Yale Medicine infectious disease specialist Dr. Richard Martinello says the data is still heavily in favor of getting the shot.
It still shows us that it's highly effective among kids, not as much as we'd like, but there's still good news in there.
He says some protection is better than none, and many Connecticut children age 5 to 11 aren't getting it.
And we're only seeing about 25% of kids who are eligible for this vaccination having received it.
Dr. Martinello says no one measure is ever 100% effective, which is why layered protections are so important.
Getting vaccinated, wearing a mask, those are really the most helpful things that we can do to keep ourselves safe and really turn our lives to normal.
The new data on falling vaccine efficacy coming as many districts across the state move to a mask optional model in schools. Dr. Martinello still recommends masking up.
Masks are safe to use. We have not seen children coming in with any complications related to mask use, and we know that they're effective.
Sean McCabe, News 12, Connecticut.
And the CDC study released today found that fully vaccinated children aged 5 to 11 were 46% less likely to end up in the hospital with COVID-19.